Hey, Dr. C here with you. So how do you optimize thyroid hormones after thyroid surgery? This is a big deal. There's a lot of folks out there who have had their thyroid gland taken out, and they need medication long-term. It's necessary. And sadly, there's a lot of situations in which people just don't feel as well as they did beforehand. It's really common that either they get brand new symptoms they never had before surgery soon afterward, or symptoms they had before are just more stubborn than ever, and they just don't seem to go away. And I'm really happy to make this because this applies to so many people, and I do believe that you can make a big difference. You know, there are some people that they have their thyroid out, they go on treatment, and they're fine. It totally happens. But that's not as interesting. What's more interesting is when it doesn't work that way. And I really believe that with some simple steps, you can feel as well as you did before. And even then, I think a big chunk of people can feel better than they did before because they're looking at some things more closely. The first thing I want to talk about is medications. Now, not the most important, but essential, and you're on them anyway. The wrong ones can prevent you from feeling well, and the right ones can be a big part of your recovery. One quick paradox to realize is that you'll need medication long-term. However, when things stabilize for you, you shouldn't need to have your meds up and down all the time. Now, there are those who are on medication that do need a lot of dose adjustments. By and large, that's more common if they have a thyroid. When you don't have a thyroid, you'll need a greater amount, but because how much you are making won't change, the amount you need should also be rather steady. Now, the first question before thinking about changing medicines is the dosage. You know, are you on the right amount? Is it a good amount for you? A rule of thumb is somewhere around 3/4 of a microgram of T4 per pound of body weight. So if you're 100 pounds, you're probably gonna need about 75 micrograms if it were in T4. We'll talk about other types of thyroid medication. That's about the same as 3/4 of a grain of natural thyroid. So here's a common problem. What if the dose you take is a lot higher than that? You know, you do a quick math with your body weight and your dose is a lot higher. The first scenario, the most typical, is that the dose is just too high. And you know that because the TSH is below range. There are many doctors and advocates who say, you got to dose based on the T3, and I get all that. I understand all the arguments, but I don't find them convincing. The first thing to change is your TSH goes below range. That is a risk. And when that happens, you cannot feel well. And a lot of folks are always trying to take more to feel better, but they don't feel well because they're taking too much to begin with. And so it's not going to work, or it won't last. It might work for a little while at first, but it's so common to be on more than you need. And that's the biggest reason for that by far. So when we see this occur, the solution is really just to be on amounts that make more sense for your body. If you're on way more than you need, there's issues with that. There's risk factors with that. And on the other side, now what if your dose is way lower than calculated? Now, if your dose is dramatically lower than you would expect, this is worth being aware of, especially if it was stable and then it dropped off. That could mean you've regrown some thyroid tissue. Now, in a lot of cases, that's cool, but if you had thyroid cancer, we wouldn't want that because that could also be cancerous tissue. So also be aware if your dose is way less than you would need, especially if it becomes that way over time. Then we think too, past dosage, about type of medication, or even the best type of medication. Well, there's a couple of options. The ones that I suggest the most are T4 by itself, natural desiccated thyroid, or a combination of the two. And here's a bit more about that. So T4 by itself, this is brands like Synthroid or levothyroxine or Tirosint. This is a really close approximation to what your body does. The drawback is that it may be hard for your body to make T3 or T2 out of that. And we'll talk more about why that can be, but I would argue briefly that before you feel the need to switch types, think about why your body isn't converting, because that's generally a problem for other reasons. And you may be able to work around it, kind of like if you got a bad foot, you could wear a brace or use a crutch, but could your foot heal in some way? That's the better solution really, because that affects you otherwise as well. Then we have natural desiccated thyroid. This is brands like Armour, NP Thyroid, Adthyza. These are cool because they've got T4, T3, and T2. They got all those hormones there. Drawbacks about those are that some people feel stimulated on them. They get a racing heart, they feel anxious, even if the dose is reasonable. And sometimes that's a matter of taking T4 and T3. Now you got two medications. I don't love that. I'd rather have your body work better by itself. But natural thyroid is a viable solution, and a lot of folks do much better on it. So it's worth considering as well. There's a few forms that I don't recommend, and this is compounded synthetic thyroid, like compounded T4, T3, T3 only, or over-the-counter. So the drawback about the compounded thyroid is just that you don't always know what you're going to get. You know, the cool thing is they could select any potency, but you may not get that potency. What comes out is not always the same as what was meant to go in. There can be a lot of quality control issues. The other big thought is T3 only medications. So there are some advocates who say that you only need T3 and T3 is best. And, if you really get deep into how thyroid hormones work, you would know that that's not true. Your body needs more than that. And not only that, but if you do take enough T3 to meet your body's hormone needs, you will have no T4 when you lack a thyroid. And the other big thing that surprises people, you won't have T2. So T3 doesn't go into T2, T4 goes into reverse T3, which goes into T2. So if you're only taking T3, you're not going to get T2. And your body needs T4, T3, T2. You need all these things in different and complementary ways. So you really want to mimic what the body would do when it's healthy. So then how can you help medication work better? You know, the biggest single factor, of course, is going to be diet. And I talked a lot about the thyroid reset diet helping your thyroid work better. Well, that's not the goal here. It's not going to help your thyroid work better because your thyroid's gone. It's not going to change that. But meds contain iodine. So when you're already at your body's upper iodine limit, and now you add thyroid medication into it, you can resist the medication because of the iodine content. So quite simply, if you've got more room for that iodine in the medication, you can use it more effectively. And the thyroid reset diet helps you get to a safe level of iodine. The other big perk about the thyroid reset diet is it gives you a good balance of macronutrients, your proteins, fats, and carbs. They're all good things. We need some of these. And you could have too much of anything, but you can also have too little of any of those. In terms of practicalities, the most common ways this can go wrong are people getting too little carbohydrate. That's a simple way to shut down your body's ability to activate T4 right there if you're too low in carbs. Another common problem is people get too little protein for maintaining their lean body mass. And over time, this can make them not be able to manage their weight quite as effectively. Now, past diet, there's also a lot of ways in which nutraceuticals can make a big difference. And this is relevant because they affect the enzymes that convert your thyroid hormones and help your bodies take them up effectively. There's a handful that have the best evidence for this. That would include selenocysteine, vitamin E, D-limonene, calcium D-glucarate, lagic acid, turmeric, grapeseed extract. These are all things that help your body utilize, convert, and absorb thyroid hormones effectively. I've combined these into the T2, T3 converter supplement, and that's super helpful for helping your body work better with T4 only. This can be complemented with hypothyroid support, which helps your body utilize the hormones after you've converted them. Last thing to think through is comorbidities. There's a lot of ways in which you can develop problems after thyroid surgery, or because you're someone who had thyroid disease, there's other things you may have as well. And in many cases, these things cause problems by themselves, but they're often missed or underdiagnosed. The first two I want to mention relate to calcium metabolism, and that's too low or too high. And it's not simply a matter of consuming the wrong amounts, it's where your body cannot properly regulate calcium. These can both be consequences of thyroid surgery. So with thyroid surgery, the parathyroid glands, which are on the sides of the thyroid, more so in the back, they can get injured and they can shut down or they can go out of control and get overactive. These show up in abnormal amounts of blood calcium. Now, hypo is low, and that's kind of obvious it's low. Hyper is high. Sometimes hypercalcemia can be caused by hyperparathyroidism, even with normal calcium. The line in the sand here is 9.8 units. If you're consistently above that, it's worth suspecting parathyroid issues. Next big comorbidity is adrenal stress. So this is real. This is how your body regulates your whole stress response. And there's a lot of ways in which this overlaps with changes in thyroid hormone production. So if your thyroid's been off, you can have a lot of issues with your adrenal slope. We think about this whenever there are symptoms that are persistent, troublesome, but recurrent. Recurrent is the key word. They come back at certain times of day repeatedly. This is best screened for with salivary cortisol tests looked at in the context of blood cortisol tests. And the cool thing is that this is something that's really treatable. Simple uses of light and food timing can help your body regain a rhythm again and make a big difference. I've written about this pretty extensively in the Adrenal Reset Diet. Next big one to mention is latent iron depletion. This is basically an early stage of anemia. This is super common. This is actually the vast majority of people with thyroid disease have a latent iron depletion. This causes so many of the symptoms, especially the fatigue, the hair loss, the joint pain, the sleep issues, the cognitive decline. And this does take someone reading your iron scores, knowing the difference between normal and optimal, and then knowing safe ways to build that up again. Oral iron is the mainstay. I made the supplement Easy Iron to make it better absorbable and better tolerated for those with thyroid disease. Most can do great on just one every other day, super easy and cost effective. Last one to mention is going to overlap with this, and this is thyrogastric syndrome. This is an autoimmune disease that 30 to 40% of people with thyroid disease also have, and it causes them to not absorb iron, not absorb B12, have zinc be low, and also have a big range of gastrointestinal side effects. This is one that it's good to be aware of because it is a risk factor for esophageal and stomach cancer. The treatments are really watching the risks and then making nutrients stay in place by more careful measures. So altogether, being aware of steps like this, you can do fine again. It does take being on the right amount of medication, being on the right type, getting your diet well regulated, being on helpful nutraceuticals, and then managing and treating any of these comorbidities. But with that, you should be able to feel at least as well as you did before it all started. All right, Dr. C with you. Take great care. I'll see you real soon.